Hi, this is John Hoffs. I want to talk to you today about the coronavirus crisis that we're in, that we have been experiencing the last while, and I wanted to share some of my observations about the crisis from a sort of historical and psychological view rather than a medical or cultural view. The first thing is that if you think about the self-isolation orders that we are all living under, where we cannot go out in public uh, in groups more than 10, where ideally we have no contact with anybody, where we can see people at a grocery store or a pharmacy, but not get any closer than 6 inches, and that we need to be constantly vigilant that there may be droplets of the virus on hard surfaces at the grocery store or wherever you are out in the public where there are hard surfaces. For example, like the laundry room of my apartment. All of these things are so repeated that I wish I hadn't even brought them up because we all already know what they are. Here's the 3 thoughts. The first is that we're being asked to stay home from work, that we're going to be paid to not work. We'll receive a check from the government of maybe $1,200 per person or $3,000 per family or something, and that a lot of the consequences of failing to pay bills and mortgages and things, loans on time, will somehow be mitigated, a term they like to use a lot, the authorities and the government like to use about slowing the spread, mitigation. And a nice word, I like that word. If you think about that you're being told to stay home and you don't have to work and kids don't have to go to school, with the exception of kids and students, college students doing online learning, but in essence, we don't have to do anything. We're being asked to do nothing, and it in a way it's like actually a dream of some people to have to not be able to not have to do anything, to just watch TV all day, or just eat, just drink, just whatever it is that you do to take up the time and to give yourself pleasure. That such a portion of the totality of the experience of mankind to the coronavirus pandemic, is superimposed upon by the sense of doom. This sense that this is a very serious disease, very easy to catch. In severe cases, terrible, horrible problems breathing, being put on a ventilator, dying. The specter of death is being disseminated or, made manifest. The specter of death is being made manifest by the situation, by not the media per se, because they're in the same situation as we all are. There's an equalizing effect. The people that are getting it, like celebrities like Jackson Browne or Tom Hanks and Rita Wilson or Senator Rand Paul, these people are now sort of brought down to earth, and we could say, well, hey, I'm glad wasn't in contact with thousands of people like a rock star would be or a politician would be, and that because of the incubation period, they end up being positive. Even with the knowledge that the risk that any of us are going to get the illness is very low, I think, from what I understand about, percentages and the law of averages, there's an anxiety and a fear that's palpable. Now, it's not there all the time, and maybe some of you are very good at having no fear, no anxiety. But for people that are by nature anxious, that are by nature doomsday, people that experience that feeling of doom, that feeling of darkness, and I have in my life, and I have during this at times, with all of that being said, there's another dimension of the experience of the coronavirus crisis that is not spoken of very much, and that is that I believe that this self-isolation, shelter-in-place, social distancing experience is forcing us to look at ourselves and to realize that we are with ourselves 24 hours a day, that our relationship to who we are and the capacity to become a better you through this ordeal, to be more appreciative of life once the relief and the joy of the ending of this will bring. The idea that nothing will ever be the same again. At first I thought, people just won't shake each other's hands as a result of this. Handshaking will go by the wayside. But, I think it will come right back. I thought about it. I thought it probably won't be done. Definitely it won't be done for months, probably. What else will forever be changed? I think that the telehealth system, and I spoke to a doctor friend of mine who's concerned that the telehealth, telemedicine, telepsychology, telepsychiatry, telehealth care that is being used very effectively and innovatively in this crisis, that it will just stay as the norm. And he was saying that doctor-patient relationship where you can look and see the person in the eye and their expressions and their body language, that will go away. I think that that could happen. And lastly, for now, because this is an everyday discourse, we're in the discourse together, that it makes us have to live in the present moment. We are living in the present moment. And I made this video after talking to my father, and he suggested I do this. And what I gleaned from talking to him was that all of us are more aware of life and we're more aware of existence than we ever have before. So until later, and that could be later today, it could be tomorrow, this has been the first of John Hoff's observations about the coronavirus crisis. Be well.